Mr. Ramkumar. I will talk short about Deepak because he's an excellent orator. He will take the stage. And then I will talk a bit on the post-stroke rehabilitation, especially the importance of inpatient post-stroke rehabilitation. And then about stroke support group, and last an important announcement. So first I'll introduce Mr. Ramkumar. He's a BBA graduate. So he had a stroke on 12th of June. He was with his friends. So immediately I contacted Dr. Swatee, and during this pandemic, in the middle of the night, she also rushed through. So we decided together while traveling the car, she discussed with me, and we decided to do a bridging procedure. Bridging procedure means we do a clot busting medication will be given. So the clot is busted, followed by we go to the area where the block is and take it out. So we decided to do that. Only problem with that is aspect score. That is the size of the lesion that we can score. So as high the total score is 10, as higher the score, better the outcome. Normally, if it's less than 6, there is poor outcome. His aspect score was 2. So we kept on discussing over phone whether it's worth doing, whether it's worth taking risk. But considering his age and that he came within 2 hours, we decided to take very big risk. And the results is there to see. Then immediately we thrombolyzed. Stroke was still progressing. So he became drowsy. So immediately we put a tube through the tube because he was losing consciousness and there will be problems with the airway. So immediately intubated him, connected to ventilator, and Dr. Ghosh was immediately called in. And so we started giving him medications to reduce the pressure. இப்போ கையில் ஒரு அடிப்பட்ட 2 நாளைக்கு அப்புறம் கை வீக்கமாகும். அதே மாதிரி மூளையிலையுமே ஸ்ட்ரோக் வந்துச்சுன்னா மூளையில வீக்கம் வர ஆரம்பிக்கும். Following which there will be big pressure inside, building up inside the brain. So we needed to reduce it. First we gave medications. But with medications, we have clear signs that it was not happening. So immediately we decided to take him for surgery, which is a life-saving procedure. And the studies have proved that if in the night itself, within 12 hours we did the procedure, and followed by the long post-stroke rehabilitation. And the results again are there to see. So it happened on June. All these 3 interventions were very important, and it was done in timely manner and in tandem. So second thing what I'm going to talk is about Deepak Kumar. So his father is my patient. So that's how on the middle of the night he called me saying that I'm not able to lift my hand. And it was there for 2 days. I'm having headache for 2-3 days. He's a lawyer by profession. In spite of all this, he was not aware of the stroke symptoms and he came late. He presented late. And he will speak for himself. I'm not going much into that. The third thing is about post-stroke rehabilitation. Post-stroke rehabilitation is a necessity, not a luxury. Look, in India, there are 2 things. One, the treatment post-stroke, the people will be reluctant to go for further rehabilitation. Actually, most of the functions can be regained by good rehabilitation. Again, Mr. Ramkumar and Deepak will talk about the importance of rehabilitation. In India, especially in Tamil Nadu, we don't have inpatient post-stroke rehabilitation services. We felt that we need to offer that to our patients. As a leading healthcare provider, we needed to offer that. So we have looked at packages where we are going to give it for 10 days, 20 days and 30 days, where we will be able to recover, we'll be able to give good results to our patients. In US, it's a standard procedure, and there are around, I looked at the literature, there are around 1,860 hospitals which offer inpatient rehabilitation services in US. So I think we should, as a leading healthcare provider, we should be doing that. We will be inaugurating ours one today. And number 3rd is about stroke support group. And so Deepak was there for the first stroke support group meeting that we did in stroke support group is important because it gives a way for the patient, that is the stroke survivor, as well as the caregiver, to get social as well as psychological support. Look, the moment when someone gets a stroke, they are not aware what to do. The caregiver doesn't know what to do. And both the caregiver as well as the stroke survivor fall into depression. So they need a lot of psychological support. So this you can derive from stroke support that we experienced it last time, and we are going to take it forward. And the last one, the stroke, the thrombectomy, now it has been increased to in selected patients. Very important, in selected patients they have increased it to 24 hours. Now every patient who comes into our system with a block in the blood vessel, we offer them thrombectomy. It is for 6 hours for every patient it is offered. But beyond that, in selected patients, we can do up to 24 hours. It has been come into the guidelines. This has not been taken to the community, taken to the masses. So we from Apollo Vanagaram have decided to take to the community. We are going to do a road show from Chennai to Kanyakumari in next week, 2 weeks time. Two neurologists will be in a bike and in a car. So, and we'll be doing 40 talks across these small towns, across Tamil Nadu. From Chennai to Ambur, and from Ambur to Pondicherry, from Pondicherry to Trichy, and Trichy to Kanyakumari. That will be doing in 12th, 13th, 14th, 15th of December. So by that, we are going to take the awareness level to masses. We know that at least one person will be benefited by this. We are doing 40 talks. At least one person will be benefited by this. Thank you.
Good afternoon, everybody. I'm Dr. Swatee, and I'm Interventional Radiologist in Apollo Vanagaram Hospital. And all of you must be thinking, what is this new Interventional Radiologist? And in a simple language, we are glorified plumbers of the body. Wherever, whichever pipe is blocked, we can open it. If the pipe is leaking, we can block it. Same thing applies to the blood vessels of the brain also. Whenever stroke happens, half of the times the stroke happens because of the blood vessel which is blocked. That is, pipe which is supplying the blood to the brain is blocked, and that we can remove it, same like plumbers do. Either Dr. Prabash gives medicines which breaks the clot, or we can go inside, apply some plastic tubes inside, some metals, jalis inside, strainers inside, and retrieve that clot outside. So actually this giving medicine and blasting the clot can have side effects of bleeding in the brain, but mechanically removing the block like a plumber does not have the side effects. Maximum what? If the clot is very stubborn, it doesn't come out completely or it doesn't come out at all, but it doesn't make the patient worse. But this clot, as the time passes, becomes harder and harder, and that is why you cannot do it after 2 days and 3 days, because by the time even the damage has happened in the brain, which is irreversible, and at the same time the clot is also so stubborn that it doesn't come out. So that is why this time limit of best in first 6 hours and little less up to 24 hours is there. The beauty of the case which we are presenting today of Mr. Ramkumar is that he's a very, very young person. I just want to highlight the fact with him that he's in his early 30s. So age is no bar. It was old teaching that cancer happens in old age, or strokes happen in old age, or heart attacks happen in old age. No longer. Any disease can happen at any age, and this is one of the, and he doesn't even have any lifestyle diseases. He doesn't have predisposing factors like diabetes or blood pressure or smoking or anything of that sort. So anybody can land up in this situation. All of us in the society have to keep it in the mind. Second important fact is that when you have some symptoms, patient himself will not be able to do anything because he himself is having stroke. He will not be able to move or talk or something. And there the supporting system around you, like your relatives, friends, your grandchildren, your neighbors. We have seen so many times stroke patients have been brought in by neighbors, and who took all the responsibility and they brought the patient. Same thing with Mr. Ramkumar. His friends as young as him, they took all the responsibility, including giving consent. They said, we will pay the advances, we will pay the bills and everything, and that's why we could take him up so early. So having the support system around you, even when you are healthy, is also very important, because you never know when you are going to land up in trouble. The third thing is that you have to reach to a hospital which has facility for doing all these procedures. You know, you have a stroke and time is brain. So time is very important. So you go to some place which doesn't have the facility, then they tell you that we don't have a facility. Then again you get into ambulance, go to some other hospital. So it is important that as a general knowledge we should know which all hospitals in our city are capable of treating such conditions which really need urgent treatment. And Mr. Ramkumar was lucky in that his friends brought him to the correct place where we had all facilities in place, all doctors and expertise in place. And that's why we could do it even during the pandemic, absolutely in the peak of pandemic in the midnight. The next thing is that whenever patient becomes sick and he has to become better, according to me, it is very, very important that patient has a very positive outlook. Only the days when he was on ventilator and intubated, he could not respond to us. After that, his every response was, how are you, Ramkumar? And he will always show thumbs up. So we really knew that within 8-10 days when he got discharged, he went on wheelchair. And we knew that when he comes for follow-up, he will come walking. Maybe walking with support, but certainly he will come walking. And when you apply this treatment fast, in a correct patient, in a correct way with your, and all these procedures do cost, and that's why having health insurance is also very important. So in our what is social awareness and all that, how you should know about the diseases and where it is treated, at the same time we should know how to cover ourselves also for those treatments, and it is very important. So this is what I would like to highlight from this case, and that was the role of interventional radiology, to mechanically remove the block from his thing. Actually, by the time in MRI it showed that only one artery supplying his lateral side, that means side of the brain, was occluded. But within 1 hour, by the time we took him up for the procedure, we understood that the entire artery supplying the right side of the brain was occluded, because disease was progressing very fast. So we could remove entire clot, but at the same time we knew that his damage is very severe, and that is why we decided that we will watch him up for the presence of edema, that means swelling of the brain. And since Dr. Prabash and we thought that it is swelling a lot, we did call upon Dr. Ghosh's team for taking care of him, for removing that skull cap so that the brain can swell. So may I call upon Dr. Siddharth Ghosh, who is our Director of Neurosciences and Senior Consultant Neurosurgeon, to brief about his role in the treatment of Mr. Ram.
My dear colleague, Dr. Swatee, and my junior and very enthusiastic neurologist, Dr. Prabash, and Sugandhi. So, with that, the stroke normally is considered as a medical disease. Yeah, that is true. It's a medical disease because patients normally don't come to a neurosurgeon. So if you talk about this multi-level, so we are at the treatment-wise, we are at the lowest level, not the highest level. Highest level is obviously the emergency department, and then neurologist, and then radiologist, and then us. So where is our role? One thing that I would like to mention here, that we always think that the stroke as compared to cardiac disease, we somehow neglect. Is it not, Dr. Prabash? Don't you agree? As people give a lot of importance to the cardiac diseases, but the stroke people don't give. Part of it is because of the the awareness of the stroke is less, but it's not really. It's almost the second largest cause of death in the country, the medical disease, and also the incidence also goes to the rural population goes to something like about anything between 80 to 220 like that, and in urban population it goes as much as 420 like that. So it is very high with amongst 100,000 population. So it is really not that low. So when a stroke comes to our emergency department, as it's been highlighted, the emergency department sees and then do the needful. If the patients, depending on immediately patient's clinical score is very important. What's the patient's, we call it the Glasgow Coma score. There are so many other scores are there. And then patient is subjected to CT or MRI. Now, depending on the MRI, we decide about how the as you was talking about the aspect score, we tell us about how the regions are involved or not. So, depending on how much region is involved, the swelling of the brain depends on that. If it's a small area involved, then the swelling of the brain will be less, and the role of neurosurgeons are not really needed. But when the neurologist sees that there is a larger area of involvement, so then they always warn us that there may be a role of surgery in these patients. So we and Dr. Prabash, like we work always together. He always tells us that, sir, this patient may need surgery, and we actually put them in our neurosurgical ICU. So this is very important. The patient should be monitored very carefully, to be monitored to see what level the patient needs surgery. Now there are some cases where, depending on the area of involvement of the brain, sometimes we decide to do it electively, because electively if the surgery is done within 24 level of consciousness, and that's the time definitely the outcome and the recovery also delays. So the role of surgery comes or close observations to decide which patient needs surgery and which patients can be managed without surgery. Now, when we see that the patient is progressively deteriorating, definitely we take them up for surgery. And or if the patient comes in a very sick stage, and after, like as the case of Mr. Ramkumar, he was gradually deteriorating, and after the thrombectomy, he had further deterioration. Why? Because the brain starts swelling up. As Dr. Prabash rightly said, if we have a small cut, it swells up. So when the brain also is an insult, it's a vascular insult, so there will be always swelling on the brain. And the brain being a very tight structure, the skull, unlike abdomen, it doesn't expand. So what happens when the brain swells? It swells, for example, the right side brain will swell, and that will push the brain on the left side, and the left side brain also will be affected. So what happens? So what we do, we take out a large part of the skull. So to show that we allow the brain to expand outside rather than inside, so that the inside compressions on the very important neural structures are not there. When that is not there, patients show signs of recovery. So that is the importance of, so surgery is really not a very major surgery. It's a comparatively minor surgery, and any junior neurosurgeons can do it. The assessment is more important, which patient needs it. Because if we do not do surgery in different, the different studies are there, the mortality can be as high as more than 50%. So we can improve the patient's mortality also by 50%. So that is one aspect. That's why the role of surgery. We not only take the skull out, we also open the dura also, which is the covering of the brain, to allow the brain to expand. And this only we do it when the best medical treatment fails. So there is always the role of medical treatment. When it fails, we do it. And after that, definitely, as you can see in case of Mr. Ramkumar, he gradually showed remarkable improvement. Yes, so he has some deficit, but I'm sure with gradual, he being young, with gradual rehabilitation program, he should improve. Like that, we can save a lot of patients' lives. So what is important in this is that we need a very comprehensive, stroke unit. It's a multi-department work. It's a teamwork which starts right from the ER. So fortunately in Vanagaram we have that. We have developed over the years a very good multidisciplinary stroke unit where the patients are taken care of immediately. And definitely I am very proud to see that our outcome of stroke is really good. And we have a large number of patients who have become better following this multidisciplinary approach. And the next, as Dr. Prabash rightly said, that the role of rehabilitations. We are working out on that because the rehabilitation in one center, as he rightly said, is quite, is neglected in India. Somehow we do the rehabilitation center. Will be probably first up in Chennai and Apollo. There is main hospital is there definitely, but in a smaller setup like here, if we can probably make a better rehab center. And as Dr. Prabash has rightly started a stroke, assist group, this is also very important because in most of the diseases now, if you talk in United States, they have this. So we also should have where the patients can at least meet together and discuss about their problem and discuss with us also that what can be done and how we can give them the the post-stroke rehabilitation and vocational training for which they can be they can utilize their time properly. With that, I will close my talk. Thank you very much. I would request our beloved MD, Sunita Reddy, to come and take the dais. Thank you.
Dr. Ghosh, Dr. Prabash, Dr. Swatee, and our patient who's been through the Apollo system. Thank you so much for putting your hope in Apollo. I hope we lived up to your trust. Today, I'm going to start by saying Dr. Ghosh mentioned a very important thing. He said that we give so much importance to the heart and we forget about the brain. So let me give you, as a person who's not a doctor, my own understanding of the brain. And probably one of the reasons I'm here today is because I understand the great work that this wonderful team is doing. The brain, for a layman, has 86 billion neurons. These neurons send messages at a speed of 265 miles per hour. The brain is capable of generating 25 kilowatts of energy. So it can actually light up a bulb. And it's probably the light, it is probably the energy of the brain that gives you the motor functions that you have. It enables you to see, to speak, to talk, to work, to eat, to sleep. It's so critical to the human body, and while we focus a lot on the heart because we're Indians, so we think, we're so emotional, we think, but we don't understand that the brain is the crux of everything that we do. So the well-being of the brain is the most important thing, and I think that part of what we need to do is to focus on the beyond, before rehab, to look at preventive health care and see how we can maintain a healthy brain. Proper sleep, proper exercise, proper diet, all these are very important in keeping a healthy brain. But having said that, I must emphasize that the second leading cause of death is strokes and incidents arising from something that happens in your brain. So it is why for Apollo, it is the center, it is one of our centers of excellence and one of the most important centers of excellence. And what we've seen around the world is that by reducing, 45% of brain deaths have been reduced because of comprehensive integrated care that Dr. Ghosh spoke about, what Dr. Prabash spoke about, and what Dr. Swatee spoke about. So what do we do at Apollo? I think that the first thing that we do is to help people, first recognize that you're undergoing symptoms of a stroke, whether it's, the inability when you see a difference in your smile, your face changing, inability to speak. It's time that you call 1066, and 1066 is our emergency number. At that time, we bring you into one of our hospitals, but even as you call 1066, the paramedic is getting to assess, your state of being and inform the hospital of what is happening. We've also tied up with Medtronics, where we layer our data on the patient with AI to come up with the right clinical protocols. So this is something that we've just started. We've launched it, and I hope it will be of great use as we take this plan forward. But beyond that, I think, what we've seen today is the work of an integrated team and what they can do. If we can prevent the 1.4 million strokes that happen every year in India, if we can prevent at least a quarter of this, I believe that we would have done our job well. If we can bring patients in the golden hour and give them the appropriate medicine, I believe that we've done, we could achieve so much more. But beyond that, I think they spoke about rehabilitation. Dr. Ghosh, we will do our best to ensure that Vanagaram also has appropriate rehabilitation. And with this, we hope that that we should reach the US standards, bring it down by 45% at least, through our integrated approach. And I'm sure that today our patient is here and he is testimony to the fact that we can do something good. I thank our wonderful doctors and the entire team for being able to achieve this milestone, but more importantly, the ability to show the world that we can do this, that even if you've had a stroke, do not lose hope, because that's what we do. I think, we continue to create hope for those who've had a stroke, and we will continue to do so. So thank you again for placing your trust in us, And to members of the media, I request you to convey this message, because you lose a battle when you lose hope. And I think that that's what we're here to show, that we have the ability to reverse damage, that we have the ability to cure, and above all, we are committed to the patient. Thank you all.
Very good afternoon, everyone. I'm Ram Kumar. நான் வந்து ஒரு ப்ரைவேட் கம்பெனி ஒர்க் பண்ணிட்டுருக்கேன். ஸோ past 4 years I was working in the night shifts. So due to on that, I couldn't be able to sleep well. I didn't take the food regularly. Due to on that, I had okay. Okay. So on last June 12th evening by 6:30 போல் எனக்கு வந்து ஓவர் ஹெடேக் இருந்தது. ஸோ இமீடியட்டாக என்னால் லெஃப்ட் லெக்கையும் என்னால் மூவ் பண்ண முடியல. ஸோ லைக் என்னோடய ஃப்ரெண்ட்ஸ் இமீடியட்டாக என்னை ஹாஸ்பிட்டலில் சேர்த்தாங்க. ஸோ doctors have started doing giving the treatment immediately. So within an hour, we were reached the hospital. Suppose that it's almost 7 months ஆயிடுச்சு. என்னால் என்னோட ஹேண்டை ரைஸ் பண்ண முடியுது, நடக்கவும் முடியுது. ஸோ ஸ்டே பாசிட்டிவ் ஆல்வேஸ். ஒன்லி 4 things நான் என் மனசில் வச்சுக்கிட்டது. ஸோ குட் திங்கிங், குட் ஃபுட், குட் எக்ஸசைஸ். ஸோ இது எப்போதுமே இருக்கணும். நல்லா சாப்பிடுங்க, நல்லா எக்ஸசைஸ் பண்ணுங்கள், நல்லா ஹெல்த்தியாக இருங்க. உடம்பு பார்த்துக்கங்க.
Primarily, I'm a lawyer, but I've been into different facets of life. In the last few years, in fact, my stroke was a few years ago, 3 odd years ago. I did not take it too seriously. I had my entire left side not functioning. And this became a major cause of hassle. The first thing Dr. Prabash told me was, leave your stress aside. I said, so easy. We can all say, leave your stress aside. Then what happens when you've actually made investments in certain things, or if you've invested your time in something, and that doesn't give you returns as expected? You get the stress of trying to get the entire thing through. You may not have any other comorbidities. I'm physically quite fit. There's no issues. But this was one of the major reasons. The surgery was done subsequently. Subsequent to which I realized that yes, life is there after a stroke. I should say I'm almost 99% back perfectly well, no issues. What I could actually tell people who had a stroke is have confidence. Don't give up hope. You have confidence, and believe me, a lot of work needs to be done. Once you are in it, you will come out of it successfully. There's nothing you need to do to give up hope. At one point I thought, okay, I wouldn't have the use calling up and telling me sleep. You need 7 to 8 hours of sleep. Impossible in my line of work. But then you do tend to follow to a large extent. My suggestions to anybody who's had a stroke is to make sure that you follow these righteous things which are given to you. If you follow them, the exercises, medication, and the follow-ups with the doctors, I'm sure you will come out without a problem. Like that's what I was discussing with this young gentleman here. Confidence. You shouldn't give up confidence. There's always hope. And all of us can come out very successfully. All those who have suffered a stroke. We've not had an issue. What Dr. Prabash is telling us, yes, we need support groups here. It's not just the immediate stroke and the after effects of the stroke. It is these support groups. What do we have for other members who've had strokes to discuss? Their experiences, how you can give them the confidence to come out of the entire thing. If possibly, people like Mr. Ramkumar and a few others had got together and we've had a discussion, possibly the confidence he would get out of people have come out of it very well is much better. And yes, I think you guys have done a good job. I would say that. In spite of lethargic people like us coming to us at the last minute, you had an excellent time. And as I was telling in the morning, that it's been a fun ride, and I'm sure we can all survive this entire thing. Thank you so much.
And Mr. Deepak Kumar, the heroes. Now, the session is open for the question and answer session. So, a gentle reminder, I request all the press members to kindly mute your mics till the Q&A session. For the Q&A session, please type in your questions along with your name, publication and city, which we will be happy to moderate.
ரெண்டாவது blood sugar சுகர் கண்ட்ரோலில் வச்சுக்கணும். அதாவது சுகரோட டயபெட்டிஸ் வந்துச்சுன்னா இன்னும் ரிஸ்க் அதிகங்கிறத ஞாபகம் வச்சுக்கோங்க. மூணாவது விஷயம் ஸ்மோக்கிங். நீங்க ஸ்மோக் பண்ணலைன்னாலும் உங்க ஃப்ரெண்ட்ஸ் ஸ்மோக் பண்ணதாலும் உங்களுக்கு டேஞ்சர் தான். ஸோ ட்ரை டு ஷன் தோஸ் ஃப்ரெண்ட்ஸ் ஆல்சோ ஸ்மோக். நெக்ஸ்ட் இஸ் ஆல்கஹால் இன்டேக். அடுத்தது கடவுள் நம்மளை படிச்சிருக்கிறது உட்காந்து வேலை செய்யறது கிடையாது, வெளில நடந்து ஃபார்ம்ல வேலை செய்யறதுக்கு. பட் இங்க நம்ம உட்காந்து வேலை செய்யறோம். ஸோ அதனால மேக் ஷுர் தட் we do regular exercises. At least 40 minutes alternate days is more than enough. Diet, very very important. Our diet is changing. We are now following Western diet, but then we need to come back to the roots to make sure that what is good for our climate, our place. And when you do these things, 80% of strokes are preventable. அது 80ங்கிறது ரொம்ப பெரிய நம்பர். சரி, ஸ்ட்ரோக் வந்துச்சுன்னா அடுத்து முக்கியமா பண்ண வேண்டியது கண்டுபிடிக்கிறது எப்படி, கூட யார் இருப்பாங்க. இப்பதான் ரீசெண்டா நிறைய பார்க்கிறோம். கிராண்ட் சில்ட்ரன்ஸ் ஆர் தேர் வித் தி கிராண்ட் பேரண்ட்ஸ் மோஸ்ட்லி. ஸோ மேக் ஷுர் தட் யூ டீச் தி கிராண்ட் சில்ட்ரன். லெட்ஸ் கோ டு ஸ்கூல்ஸ். டீச் ஃப்ரம் தி ஸ்கூல்ஸ் தி சிம்டம்ஸ் ஆஃப் ஸ்ட்ரோக். பி ஃபாஸ்ட். நிறைய பேசியிருப்பேன், அதனால அதை பத்தி நான் பேசல. பட் அந்த ஸ்ட்ரோக்கோட எப்படி கண்டுபிடிக்கிறதுங்கிறது வீட்டில் இருக்கவங்கள்ட்ட சொல்லுங்க. அடுத்த முக்கியமான விஷயம், எங்க கூட்டு போறது. 2 டைப் ஆஃப் ஸ்ட்ரோக் ஹாஸ்பிட்டல்ஸ் இருக்கு. ஒன்னு காம்ப்ரிஹென்சிவ் ஸ்ட்ரோக் கேர் சென்டர், வேர் an emergency physician can diagnose with a CT. Then a neurologist, they are available 24 hours. An interventional person is available 24 hours, and a neurosurgeon is available 24 hours to take care of any emergencies. The next level, one level below, is stroke ready hospital, where you can do a CT, thrombolize the patient and shift to a comprehensive stroke care center. ஸோ இருக்கிறதுலேயே முக்கியமான அவேர்னஸ்ங்கிறது எல்லாரும் கேட்பாங்க, ஸ்ட்ரோக்கு ஃபர்ஸ்ட் எய்ட் என்ன பண்றதுங்கிறது. ரெண்டு தான். கண்டுபிடிக்கிறது எப்படின்னு தெரிஞ்சுக்கோங்க. ரெண்டாவது, உங்க வீட்டு பக்கத்துல எந்த ஸ்ட்ரோக் ஹாஸ்பிட்டல் இருக்குங்கிறது கிளியரா தெரிஞ்சுக்கோங்க. பெட்டர் தட் இஃப் யூ டேக் டு a comprehensive stroke care center. நிறைய தடவை with due respect to small hospitals, but then we waste a lot of time in going to there. அதுக்கப்புறம் பார்த்துட்டு கண்டுபிடிச்சிட்டு வரதுக்குள்ள நிறைய டைம் வேஸ்ட். with due respect to them, they are doing wonderful job. But then when you come to stroke, if the comprehensive stroke care center, we will be able to preserve the damage ஆகாம பார்த்துக்கிறதுக்கு நிறைய நம்ம பண்ண முடியும். இப்போதைக்கு ஆல்ரெடி பேசியிருந்தோம், 24 hours வரைக்கும் எக்ஸ்டெண்ட் பண்ணியிருக்கோங்கிறது. அது பட் செலக்டட் பேஷண்ட்ஸ் தான், அதுவும் முக்கியமாக ஞாபகம். Number 2, stress levels are very very high these days. Number 3, the change in diet habits. இது மூணு தான் மெயினான விஷயம். sedentary lifestyle. இது மூணு நம்ம கவனிச்சிட்டோம்னாவே மேஜர் பார்ட் ஆஃப் தி ஸ்ட்ரோக் நம்ம ப்ரிவென்ட் பண்ணிக்கலாம். இன்னொன்று, ஏர் பொல்யூஷன். தட் இஸ் கோயிங் டு பி ஒன் ஆஃப் தி மோஸ்ட் இம்பார்ட்டன்ட் ரீசன்ஸ் ஃபார் ஸ்ட்ரோக் இன் தி நெக்ஸ்ட் டெக்கேட். இட்ஸ் கமிங் அப் வெரி ஃபாஸ்ட்.
The other thing is no regular exercise. That's very important. Should have regular exercise to keep your fitness. So nowadays, because of the net and all, people are mostly sitting and doing their work. So there is no adequate exercise in life. That's very very important.
I would mind of denying the presence of disease. You see many times that patients come to you and you ask them, do you have diabetes and blood pressure? No, once I had checked it was there, but after that I am taking care of my diet and exercise. But did you go and check your blood sugar levels again? For that they say no. Or whether the BP you have checked again, they say no. So there is no point in denying the existence of diseases. It is much better that we treat and prevent the complications which happen through them.
One more point I like to add is the screen time that we all have now. Screen time is going to hamper a lot, especially after 8 o'clock. That is 2 hours before sleep, better to avoid screens.
So the next question, is there...
The 106 is dialed, they will initiate the stroke protocol. Whichever the nearest stroke hospital is there, they will take you to that hospital, and all the neurologists, the neurosurgeon, everyone will be intimated immediately. So 1066. Usual stroke, I'm not telling about the uncommon ones. Usually they require around 6 to 7 days of hospital stay. But in case of like Ramkumar, where the disease damage was more, he will require a bit more of hospital admission. But then post that, he will not require that level of care. So we had a discussion and then decided that we will have a less level of care, but then the rehabilitation services are given more prominence. Like it is, as Dr. Ghosh sir rightly said, it's not only about physiotherapy. Primarily, it's the mental build-up that is requires a lot of support. They look at
everything less than any other normal person. So similarly, this different aspect of now online training available, which are also shown them to see what they can adapt, like music or some of the instruments which they can learn. So there are different things on this. There are which are taught to them other than regular physiotherapy.
Thank you so much, sir. Would this rehabilitation center be open for any stroke patient, even if they did not take treatment at Apollo?
Yes. We have formulated a package for that. Look, our patients, once the post-acute care is done, we will transfer them to the center, and we will receive
rehabilitation services.
We have worked out a package where 5,000 rupees per day is the basic charges. Like they will take the other than consultations and investigations, 5,000 rupees is the charges. That is what we have worked out.
Thank you for that information, doctor.
That I'm not sure. A good question. We will work on it. Thanks for that. I'll look into that. As Madam said, we should be looking into that. The acute care is actually covered. The rehabilitation, I'm not sure. We will work on it. Thanks for that.
Great achievement by our team of doctors and the clinical team at Apollo Specialty Hospitals Vanagaram to have saved so many lives in the golden hours and making them lead a happy life today. Every program has an end, though not permanent, but a short goodbye before we meet again. I now request Dr. Prabash to render the word of thanks.
I, Dr. Prabash, on behalf of Apollo Specialty Hospitals, Vanagaram, and the entire fraternity of the institution, first of all extend my most sincere thanks to the Almighty God for making today's event a memorable one. We would not be here without our hospital's generosity, so first and foremost I would like to thank Apollo Hospitals for giving us the opportunity to gather here today. On behalf of my hospital, I extend really hearty vote of thanks to our MD, Mrs. Sunita Reddy, who spared her time from her busiest schedule to grace the occasion. Today we had an opportunity to hear your thoughts, and this will surely be going to encourage us in our future events. I'm immensely thankful to our COO and DMS, Dr. Rahul Menon, for his efforts towards organizing the event and giving the welcome address. A special mention to our respected JDMS, Dr. Paul, for his guidance and support for arranging this meeting. I thank our beloved Head of the Department Neurosurgery and Director Neurosciences, Dr. Siddhartha Ghosh, for the keynote speech. I need to mention my deepest sense of appreciation. I thank other dignitaries, Dr. Swatee Halbe and Dr. Muthukumar and Dr. Ebenezer, who are part of our team, who are not able to come today, for gracing the occasion. Teamwork is the ability to work together toward a common vision, the ability to direct individual accomplishments toward organizational objectives. It is this fuel that allows common people to attain uncommon results. We think we are very common people, but we were working as a team in tandem to work for good goals. Stroke management is a closely knit teamwork. As Dr. Ghosh rightly said, from the ambulance driver, it starts from there, and the emergency responders, the ER physician, and then comes the neurologist, the interventional person, and the neurosurgeon, the neuropsychologist, and neuropsychiatrist, the physiotherapist, speech and language pathologist, the nurses, the most important person, I cannot miss them, the special stroke nurses, and the housekeeping. There's a big team. It's an example for a perfect teamwork. We saw the effect of this teamwork in the case of Mr. Ramkumar, with individual members working in tandem to achieve the awe-inspiring result that we are seeing today. I thank both stroke heroes, Mr. Ramkumar and Mr. Deepak, for sharing their story and experience. My gratitude to all the speakers for gracing the occasion and sharing their expertise today. Your thoughts have enlightened our minds. I thank all the invited attendees from the press for sparing their valuable time. An event like this cannot happen overnight. The wheels started rolling weeks ago. It requires planning and a bird's eye view for details. We have been fortunate enough to be backed by a team of very proactive and dedicated staff of our organization, and I extend my thanks to all the members for their enormous cooperation. Special thanks to Mrs. Sugandhi, Mr. Shanmugam, and Mr. Venkat. I'm short of words for their involvement and their willingness to take on the completion of tasks beyond their comfort zones. I would also like to thank the people who worked behind the scenes to make this event happen, our technical arrangement team, stage setting, light arrangement team, and the housekeeping staff. Thank you everyone for taking the time to be here today and for listening to our talks. We are so grateful to this opportunity. Have a great week.